Hi, family and friends. It's Angelina and David here. I wanted to give y'all an update on my health issues that I've been having. Um, as some of you know, I've been dealing with a heart situation. I've been feeling fine, but I have been visiting a cardiologist, and I did go to the surgeon today to find out what the next steps are. So in 2017, I had gotten diagnosed with cardiomyopathy, and every year since then, I've gone and visited with the cardiologist. And about 2 weeks ago, or 2 to 3 weeks ago, I had a heart catheterization done, and I do EKGs every year and MRIs to see where my heart is and how it's functioning. And with this last heart catheterization, the doctor noticed a couple of things that alarmed him, and so today we met with the surgeon because I knew going forward the next step was going to be some sort of surgery. So I'm going to kind of let David give you guys the run through of that. It's a lot of information to put in a text message, and I know you guys are going to have questions, and we just we felt this is probably the best way to explain ourselves to you guys as best as we can.
Alright, so Angie has four problems going on with her heart, which is one is the cardiac myopathy, which is the enlarging of the heart. So Angie has a narrow artery, and because that artery is narrow, the blood can't pump through like it's supposed to. So the heart naturally will pump harder to get more blood through it. And just like any other muscle that you exercise, the more you use it, the larger it gets, and that's what's causing the enlarged heart. What's causing the narrowing of the artery is she has an aneurysm, and this is what we think. We're not 100% sure this. We should have asked, but of course questions always arise after your appointment. But we think that the aneurysm is what's blocking the artery, and so that needs to be addressed as well, and will be addressed when we get to surgery. And so because that narrowing of the heart has caused the heart to get bigger, sorry, my phone's ringing for some reason. They're kind of causing one in the other. She has your heart valves have three flaps, and Angie has two of them that are fused together, and so that is what the heart valve replacement needs to be done. Let's see. So there are two types. Hold on, let me turn off my phone real quick because I'm getting a bunch of text messages. Sorry. There are two types of valves that she can go with. There's a mechanical valve, which would be metal, and then there's a tissue, which would be a valve from a pig. So I can call Angie my chicharron. And I try to joke because I'm trying to keep it light. The complications of having a metal or mechanical valve, heart valve, is that one, Angie would have to be on blood thinners for the rest of her life, and those blood thinners would cause her to bruise easily. If she were to fall, she could have internal bleeding and not know it, or it could cause a thrombosis. And I guess the positive side is that it would last much longer. The doctor did say that other complications could be an infection, and if she did have an infection or a malfunction, they would have to go again and do open heart surgery to have it replaced. The other option is using a pig valve or a tissue, and that tissue, the complications, what we heard, were a lot less than the mechanical one. One of the downsides is that it does wear out because it's tissue, and so she would have to have it replaced within 20 or 30 years, and that would put Angie in like her 60s. The Dr. Morales did say that it's not being done now, but the way he sees technology and medicine kind of improving, that when that time comes when Angie would need to have the replacement done, he thinks it would be done through a catheterization or through a surgery on the side instead of having to open her up, having open heart surgery again. So that surgery would be a lot easier on her when she gets a little bit older. And it would be less invasive. And then I guess that's all the issues, and that's the technical part that we both heard when we were in the meeting. So then I guess Angie.
So David and I, we've spent most of today deciding what route we were going to take, and I've decided to go with the tissue valve replacement. I think that's going to be the best one for me. Dr. Morales did go into detail that because of my age and had I been between 30 and 40, he would tell me do the mechanical. If I was 40 or 50 to 60, do the tissue. But I'm in that gray area.
We had to do research and kind of talk out what was best for us.
Decide what was best for us, and I didn't like the complications that the blood thinner was going to bring about, so that's why I'm deciding to go with the tissue valve replacement.
The valve replacement is a very common surgery. He said he does about 4 or 5 a week, so he does it all the time. While we were there in the office, the walls were kind of thin. We could hear him talking to other patients, and the two before us had already had their heart valves replaced, so they sounded very happy with the procedure that had been done, and so we're confident in his capabilities of performing that surgery.
Yeah. So apparently this is something that I've had my whole life. It didn't start manifesting until about 3 years ago. But both my cardiologist and the vascular surgeon are surprised that I've never had any issues from birth to now. So that brings us into when the surgery is going to be. So he did say, you don't want to delay it. You want to do it as soon as possible, but that has to be my decision as well. So he had openings this week in December the 14th through the 16th, or January 11th to the 13th. I've decided to go with the time frame between December 14th and 16th, so I'm waiting on a call back from them. At first I was shooting for January, but after talking in more detail with David and going over everything, I feel that December's the best time frame, because at this point it's kind of been a miracle that nothing has happened to me. It's kind of like I'm on borrowed time, you just never know what can happen. One of the concerns that both doctors have is the fact that the way that the narrowing is taking place, it can cause a rupture at any time, and then I still have to do the surgery, but more in an emergency aspect. So instead of us waiting for that, it's best to have it scheduled and be prepared as to what's going to happen. So somewhere between December 14th and the 16th, I'll be having the surgery.
God willing.
Yes. Recovery time will be 5 days in the hospital, and then a week at home, and then after that 6 to 8 weeks for full recovery. I've spoken to my job, my staff. My boss has been very good to me, and he, basically you do what you have to do to take care of yourself and get your family prepared, and I think the next 2 weeks will be us doing that. We've talked to the children tonight. They kind of know what's been going on, but we had a more in-depth conversation with them this evening, and I think they're still very little to really understand, but I think they know. I'm worried, I'm scared.
Naturally. We're also planning to ask our church to do a meal train for us for those 2 weeks. The week that the 5 days Angie will be at the hospital, and then the week that she'll be at home. And we'll share that with you guys as well. If you want to sign up for a day that you can bring us dinner one day, even if you buy it or whatever, that would be greatly appreciated. Of course, your prayers are appreciated as well. If you guys have any questions, please reach out to us and ask us, because asking everyone else and not us, everybody else is going to know what you guys know, and so we're open, to whatever questions you have for us. I guess that's pretty much it in a nutshell. I know it's a lot of information to take in, but we're at 10 minutes already with our video. But we just wanted to keep you guys in the loop, make sure that everyone kind of understands, is on the same page as far as what's going on with Angie. We love you guys. Also, because of Angie's situation of going into surgery, we're really asking that everyone respect not coming to the house just for the next 2 weeks, because we can't afford Angie to get sick and then having to delay the surgery even further. And we hope you guys understand. You know, all of us are on, most of us are on Facebook, or we have an Apple phone. You can FaceTime Angie on her work phone, or video chat us on Facebook Messenger, and you know, you guys can see Mom. That way, it just we're really trying to. We've had a couple close calls since Corona hit, and we don't want to take the chance of getting Angie sick or exposed to something that she doesn't need to be exposed to. And we thank you for understanding. If you guys have any questions, like I said, reach out to us, either Angie or myself, and we'll answer you guys as best as we can, or call us.
Yeah.
We love you guys, and thank you.
Love you.
We'll be in touch.
Thanks.